Hello everyone, my name is Courtney Cook. I'm a licensed board-certified genetic counselor and I'm the founder of Cook Genetics Assessment and Testing, which is located in Effingham, Illinois. Since I recently launched this business and since genetic counseling services are so new to people living in South Central and Southern Illinois, I really wanted to make some videos to explain why somebody might consider having a genetic counseling appointment and possibly having genetic testing as well. So over the course of the next few weeks, we're going to be releasing a lot of different videos that will talk about different indications for genetic testing. So who should be referred to genetic counseling, who should think about doing genetic testing, and a lot of this is based on what we see in you or in your family. So at Cook Genetics, we really focus on hereditary cancer, so we're going to start there. And I know that the big one that a lot of people worry about is hereditary breast cancer. So what we'll do today is we will focus on hereditary breast cancer and who should be referred to genetics based on their personal history of breast cancer or their family history of breast cancer. So let's get started. So the first reason that somebody might be referred to genetics is if they were diagnosed with breast cancer at age 45 or younger. So any woman diagnosed with breast cancer at age 45 or any time younger than that automatically meets criteria for genetic testing. So this is recommended for all of these women in this young age category. We also recommend that anyone who has had a first-degree relative or a second-degree relative who has had breast cancer diagnosed that young get genetic testing. So for example, your first-degree relatives are your parents, your siblings, and your children. Your second-degree relatives are your aunts and uncles, grandparents, grandchildren, nieces and nephews, things like that. So if you're looking through your family and you know that one of your close relatives has been diagnosed with breast cancer at age 45 or younger, then maybe you should consider doing genetic testing as well. So that's the first indication. We really look for people diagnosed with breast cancer at those young ages. Now our next indication, we go a little bit older. If somebody was diagnosed with breast cancer at age 50 or younger, and they have a family history of another relative diagnosed with breast cancer at any age, then those people should consider doing genetic testing. So again, this person who is diagnosed with breast cancer could either be you or it could be your family members. So if it's your family members, one person needs to be diagnosed either at age 50 or younger, and then you need to have another person with breast cancer at any age in your family. This is also a good point to bring up that whenever we say in your family, we are implying the same side of the family. So it would have to be, for example, your mother and your maternal grandmother or your mom's mom. It doesn't count if you've got a breast cancer on dad's side and a breast cancer on mom's side. So they need to be on the same side of the family, but it can be on either side. It can come from dad's side of the family or mom's side. So first we talked about that super young breast cancer diagnosis. Then we talked about age 50 and younger with another relative diagnosed with breast cancer. So let's go on to our third indication. So this is still in that 50 age group. So if anyone has been diagnosed with breast cancer age 50 or younger, and then they have a close relative who's been diagnosed with ovarian cancer, pancreatic cancer, or a really advanced prostate cancer. Those people should consider undergoing genetic testing as well. So again, if you are one of those individuals who has had that sort of cancer yourself and has that type of family history, then you should get genetic testing. Or if that is just something that's been going on in your family, like a grandma and an uncle or something like that, then that is another reason for you to come get genetic testing. So that third indication, breast cancer at age 50 or younger, and then other types of cancers in the family like ovarian cancer, pancreatic cancer, or prostate cancer. Now our fourth indication, we're just going to kind of keep building on this, would be if somebody was diagnosed with breast cancer at age 50 or younger, and then they have had a second breast cancer themselves. So say, for example, grandma is now 75 years old and she was diagnosed with breast cancer at the age of 50, and then she got diagnosed with a totally new breast cancer 25 years later at the age of 75. So one person having two different breast cancers, with the first one being under the age of 50, those individuals need to get genetic testing. Or again, somebody in your family that's closely related to you, if they were in that situation and maybe they passed away, then maybe you should consider getting genetic testing. Where are we on now? 5. Our 5th reason to get genetic testing would be that if you were diagnosed with breast cancer at age 50 or younger and you were adopted, so you don't know your family history. This is not the same as knowing the people in your family but not knowing about any cancers. That's really not the same thing. We mean if you have breast cancer yourself, you're 50 or younger, and you have no idea about anybody in your family because you were adopted or something like that, that would be a good reason to get genetic testing. Now, our next indication is if someone has had triple negative breast cancer under the age of 60. So triple negative breast cancer is kind of how we describe a breast cancer that has certain characteristics. So we know that the majority of the time breast cancers are fed by hormones. So we typically look at those breast tumors and we try to see, is this breast tumor estrogen receptor positive, meaning that we did find some estrogen receptors that act like magnets on the breast tissue, and any estrogen in your body might be feeding that breast cancer. So if somebody's tumor is estrogen receptor positive or progesterone receptor positive, that's a more common type of breast cancer. If you're triple negative, this means that you don't have any of those receptors. So you're still developing a breast cancer even though it's not being fed by hormones. So that's a very rare type of breast cancer. But if anyone in your family or if you yourself has had triple negative breast cancer at age 60 or younger, then genetic testing should be something that you should think about. Now, our next indication is whether there's any male breast cancer in your family. So I know that we always think about breast cancer being a female cancer, but it's really not. Males have breast tissue as well. They don't have as much breast tissue as women do, but there is some there, and men can get breast cancer. So if you are a male who has had breast cancer yourself, absolutely genetic testing is indicated for you. And then, of course, if you had a family member who had male breast cancer, so if your father had male breast cancer, or your uncle, your brother, that would be a good reason for you to think about doing genetic counseling and possibly genetic testing. Our next indication is having a breast cancer diagnosis at any age, doesn't matter how old you were, but you have a family history or an ethnicity of Ashkenazi Jewish ancestry. So Ashkenazi Jewish ancestry, this is a type of ethnic group, kind of like the European Jews. We know that people of Ashkenazi Jewish descent are more likely to have changes in these genes that can increase their risk of cancer. Anybody can, but if you're from that ethnic group of Ashkenazi Jews, your chance is a lot higher because that population of people have a few what we call founder mutations. So these little genetic changes that have kind of gotten passed around in that small population over time. So if you have breast cancer yourself and you have Ashkenazi Jewish ancestry, or if your mom's side of the family is Ashkenazi Jewish and your grandma on your mom's side had breast cancer, then that's a good idea that you should get genetic testing. Our next indication here is if somebody in the family has had breast cancer at any age, and then of course they have a close relative with ovarian cancer, prostate cancer that's been metastatic, meaning it's spread to other places in the body, ovarian cancer, or male breast cancer. So if one person on that side of the family had breast cancer, and then anybody else on that side of the family had one of those more rare cancers, pancreatic, ovarian, metastatic prostate, or male breast, then that person should consider undergoing testing as well, or of course the unaffected family members if those people who had cancer have passed away. Our next criteria would be if there are a total of 3 breast cancer primaries in the patient or in their close relatives, regardless of age. So say our patient had breast cancer at 51, so she didn't meet our 50 cutoff earlier, but her first breast cancer was at 51, and then she got a totally new breast cancer 10 years later at 61, and we know that her mom passed away years ago from breast cancer at age 80. Then that's 3 different breast cancers in that person and her family, and that way that person meets criteria for testing. So we really have to make sure that those breast cancers are totally separate breast cancers in the same person. So not that the cancer came back and spread, but did they get a totally different breast cancer that popped up on its own? So 3 different breast cancers in at least 1 or 2 people on the same side of the family, then that way those people can get genetic testing as well, because that's a lot of breast cancer. Our next type of breast cancer is another more rare type. This is what we call lobular breast cancer. So lobular breast cancer is more rare than ductal breast cancer. If you think of the breasts as like a bunch of grapes, you have the stems of the grapes and then you have the actual fruit of the grape itself. So the breast is similar in the sense that you have ducts in your breast. That would be like the stems of the grapes. And then the lobes of your breast are similar to that fruit. So you have your ducts and your lobes. Most breast cancers are ductal, meaning they occur in the ducts of the breast, like the milk ducts. If there's a lobular breast cancer, that's much more rare. So anyone who has had a lobular breast cancer, and then they also have a close relative who has had diffuse gastric cancer, that's another reason to come get genetic testing. So there are some genes that increase the risk of getting specifically lobular breast cancer and diffuse gastric cancer. And those are totally unrelated to some other breast cancer genes. So if you have had lobular breast cancer and you know someone in your family had this really aggressive stomach cancer, then that might be a good reason for you to come get genetic testing as well. So again, if you have any of this going on in your family, and maybe those relatives have passed away, or they're not interested in doing genetic testing, then you of course can come get genetic counseling and genetic testing yourself. We always recommend that we try to start with the person who has actually had that cancer themselves in order for our testing to be most informative. But we understand that that's not always going to happen. Either those people don't want to get tested or they're no longer here with us. So if there's anything like this going on in you or in your family, that's a good reason to come have genetic counseling about hereditary breast cancer and other genetic testing as well. So, one other thing that I like to bring up, because this is now a more commonplace trade in the last few years, if a woman or a man is diagnosed with a cancer and they do a tumor profiling on this person, this is what we call genomic tumor testing. It's like genetic testing of your tumor itself. This is really for targeted chemotherapies, things like that. If you get a tumor test back from your doctor and it shows that there are certain mutations in those genes, then we might say, okay, maybe we should test and see if this is something that you were born with. So all that stuff kind of gets complicated, but that would be a good reason for you to talk to your doctor and see, hey, did anything come back on my tumor test? And is this something that we should look for genetic testing wise with a genetic counselor to see if this is something I was born with, or is it something that just popped up in my tumor over time? So if that's something that you've been dealing with lately, if you've had a cancer diagnosis yourself, you likely have probably had some tumor testing, and maybe just checking in to see what the results of that were, and if your doctor found anything in there that they might think that you should get genetic testing for, you can always call us and let us know about that as well. We don't really recommend that family members use tumor testing as a reason to come get tested. So for example, if you're a 30-year-old woman and your mom was just diagnosed with breast cancer and she had tumor testing, we don't want to test you, we want to test your mom. That tumor testing is pretty specific to that person, whereas the other indications we talked about, those combine, personal history, family history, things like that. So if you've got any of these young cancers, rare cancers, lots of cancers on one side of the family, bottom line is having a genetic counseling appointment to kind of tease that out is sounding like it's going to be right for you. So that was focusing on our hereditary breast cancer. We'll come back and do some other videos with other cancer indications in the future. If you'd like more information about genetic counseling or genetic testing, please visit our website. It's www.cookgenetics.com, and feel free to reach out to us by email, Facebook, Instagram, if you have any questions. So my email address is courtneycook@cookgenetics.com. So let us know if you guys need anything, and we look forward to seeing you soon.